Hi everybody, my name's Brooke and I am an Obstetrics and Gynaecology Doctor, and I'm here as part of this series about sex and endometriosis to talk about what might happen when you go and see a doctor about this condition, what tests might be done, and also what treatments you might be offered. So first off, why may you go to the doctor? Well, if you're worried that you might have endometriosis, the common symptoms might be very painful periods, pain during intercourse, pelvic pain, chronic pelvic pain that you seem to have all the time at other times of the month as well, and also difficulties getting pregnant. So if you're having any of those symptoms, definitely worth see the GP and talk about those problems early. What they'll often do is ask you a series of questions, including things about your medical history, about what your periods may be like, how long they've been going on for, how painful they are. They'll also ask you about any pregnancies that you may have had, any surgeries you may have had in the past, and they may examine you as well at that time and refer you for any tests. So the main test they might refer you for would be something like an ultrasound scan, and then depending on what comes back, you may or may not be diagnosed with endometriosis at that point. However, your doctor may choose to refer you to a gynaecologist such as myself. And then we can decide whether or not to organise the main investigation to help us understand exactly what's going on in your condition, and that is a laparoscopy. So that's actually a surgical investigation. It means that we, through keyhole surgery, put a camera inside your tummy and have a look around. And what we're looking for with endometriosis is mainly to see any deposits, because what it is when the lining of the womb is growing in a place that it shouldn't do. So it might be growing on the surface of the ovaries, resulting in ovarian cysts. It might be growing in certain parts of the abdomen, such as behind the uterus or on top of the uterus. And that can also cause things like adhesions, where parts of the body stick together. So for example, your bowel might be stuck onto the uterus. And all of these things can result in the pain that you experience. The next step is to think about treatment. So if we know you've got endometriosis, the thing that we commonly start with is just simple painkillers just to see if that helps, but often that may not help entirely. The next step would be to consider other medical treatments, so they might include hormones, and the main one we're talking about here is progesterone. So we can give progesterone via the progesterone only pill or the combined pill, either of those, to ideally to down-regulate the effect that the deposits might be having, or to give progesterone in a form like with a Mirena coil or the implant. So they're all different forms of progesterone, and they can have quite a significant effect on improving the pain you experience also with intercourse itself. If those aren't enough, then the next step would be to consider surgical treatment. And the majority of the pain that women with endometriosis experience during sex might be due to deposits of endometriosis that are at the top of the vagina or between the uterus and your rectum. And so if we can see those areas and we treat them, that might be by burning them with a bit of heat or a laser, then what that can do is to remove those areas of endometriosis and improve your experience of sex. However, it may be that those areas can grow back or other areas of endometriosis form in the future. So having had surgery once doesn't mean that you'll never have it again. But what we might need to do as doctors is work together with any patients that have endometriosis, and it's to plan the surgery for at the right time for that patient, because you might need 2 or 3 surgeries in your life, but making sure that we do them at the right time to make that bit of endometriosis, to treat it at that time for whatever symptom is bothering you the most, without increasing the risk of things like adhesions forming, because each time you have surgery that can increase that risk. So it's just a balance of working together with your doctor and also combining that with the other treatments that are available. And on top of that, just remember that there is loads that we can do to improve your experience of sex that doesn't just involve medication and surgery, which is kind of covered by the other brilliant speakers in this series. So have a look at their videos and don't forget to send in your questions.